Hi, everyone. We're just going to allow a few people to get their audio connected. We do ask that you press mute while we first go over the overview and setting the ground rules, and then we'll dive in and you can join in however you desire. All right. I know we had several more people registered to attend, so they might just be joining us a little bit late, but we are broadcasting today's session on our YouTube channel so that we're able to capture all of your feedback in real time. And with that, I would like to turn it over to Miss Sika Rose Green.
Good morning, everyone. I think it's still morning. Thanks so much for joining us. We appreciate you being here. You are well aware, I think, of where we've been as far as FRCs are concerned. And as we go to reprocure, we wanted to have some feedback sessions, as well as we had a great presentation from communities that already have FRCs up and running. That information is on our YouTube channel, and we are hoping to get the PowerPoints. We can have that available as well so that we can take this opportunity to go back out with a procurement that not only gets to the point of where the council wants to be, but also makes a lot of sense to those of you who may apply. So with that, I'd like to turn it back over to Holly. Please feel free as questions come to you to either jot them down or you can put them in the chat. We may not answer them in the chat immediately, but we will go back as time permits at the end and go back through those questions and answer them. So it is your show, Holly.
Thank you, Sika, and thank you everyone for joining us. As Sika said, we are here. We'll kind of provide a general family resource center overview in case you were not able to join us this past Friday or haven't gotten quite through all 2 hours of that show and tell. We have kind of synthesized some of the major lessons learned from the 3 providers that joined us. As a reminder, if you have not watched it and you want to be able to watch it, it is available on our YouTube channel as well as linked on our website. Our 3 presenters, one came from Florida, right just immediately to the east of us over in Alachua County with Partnership for Strong Families. We also had a presentation from Connecticut and their family resource centers. They actually have a statewide coalition and alliance up there for their family resource centers. And we had one representation from East Haven up in Connecticut. And then the 3rd presenter was actually just a little bit north of us in Atlanta, Georgia, and kind of like how they've used the family resource center model to really adapt to a growing Hispanic population, Spanish speakers. So we heard from 3 very different programs, how they use a family resource center model specifically to engage a very targeted population and how they've implemented it. And all 3 of them are nationally recognized family resource centers. So part of what we're looking for here in Leon County is that direct responsiveness so that we can develop that. After we go through that kind of overview, we've developed some very specific questions that we'd like feedback on, and that we'll dive into that. And that's when I will ask you to come off mute. You can use the chat, but we'd also like to have the opportunity to have some discussion. And while you're sharing, we'll actually be capturing that feedback in live time as we move forward. To get us started, I want to share that we conducted a needs assessment last year, and it identified the need for improved access to services. Despite there being more than 1,000 providers in Leon County alone servicing children, youth, and families, but because of access barriers, namely transportation, the true potential of many of these providers has not been realized. Further, the barriers that perpetuate the inequities in this community really do limit very specific neighborhoods from achieving their true potential because they don't have access to those services. So we responded by hosting some family listening sessions on what does family support mean this past spring. And in that conversation is where we discovered that the #1 requested family support service was this idea of trusted navigators. And based on our needs assessment, that paired very nicely with this idea of family resource centers. The other kind of high requested services that emerged during that family support listening sessions this past spring primarily focused around basic needs. So housing, healthcare, food stability, cash assistance, like meeting those basic economic needs, followed very closely by early childcare services and support. So using the information from the needs assessment, bolstered by the prioritization of our council members, and then further supported by those family support listening sessions, we adopted a plan to build these neighborhood-based staffed resource hubs as a direct response. So FRCs are a very kind of distinct model, and oftentimes we think of family resource centers, and we covered this on Friday, but I'll just kind of brush over it very quickly here today, is that this idea of a family resource center, like what does that look like? Do they already exist in Leon County? How can we strengthen them if they do exist? Or what do we need to build if they don't truly exist in the way that we're thinking of them? So what we'll share is that family resource centers are place-based resource hubs where families can access formal and informal supports with the goal of supporting and promoting their health and well-being. So sometimes these are called family success centers, family support centers, parent-child resource centers, parent education centers, but where they all kind of align is that they're very family-centered and focused on uniting the family that comes in directly with services, but it's done in a very strength-based approach where the family is driving the services. Centers, as we heard and learned on Friday, can really be located anywhere. They can be in apartment complexes, health centers, schools, libraries, community centers, storefronts, anything like that. We also learned that the services can vary widely, but they typically include some combination of parent skill training, maybe job training, some mental health services, maybe some family and housing supports. Oftentimes there's literacy programs, and then they're paired up with some sort of provider for concrete support, such as food or clothing banks. And again, this idea of family resource centers aligns very nicely with what our needs assessment said, the recommendations that emerged from that, and then again, bolstered by those spring sessions that we held in the community in 3 different areas. Our goal is that family resource centers would be a one-stop shop for children and parents that address the protective factors framework. If you've been following along with CSC, you might have heard us talking about the protective factors, and that's parental resilience, social connections, concrete supports in times of need, knowledge of parenting and child development, and then the social emotional competence of children. So while a lot of programs in our community today, like our food banks, employment centers, our community-based clinics, our churches, they are an absolute necessity and an important resource for our families, but they're not what we're talking about as a family resource center, because what we're looking for is, yes, something that is uniquely community focused, that the services are driven specifically by the family needs, that the family says are their needs, and they're offering that multiple of programs, but that they follow a set of national standards. And so that's where we found that what we have in our community and what we're trying to build, that's where the separation is, that we're really looking for centers that are going to adhere to these national standards that have been researched to determine that these in essence are the best practices or the standards, so that we can ensure that we move the needle. The truth is that children living in poverty for Leon County has been around 20% of the population for as long as I can remember, and we haven't been able to move that needle. And with the CSC investing in very specific areas and helping to overcome the barriers that exist to accessing existing resources, our goal is to move that needle. So those national standards that we talk about, you're going to it starts to feel a little redundant because of these themes that start to emerge with this idea of family-centeredness. So this means that we're recognizing and valuing the family to drive service delivery and design. That family strengthening is how do we utilize a very specific approach so that that families are promoting their success and optimal development based on, again, what their needs are. A very strong commitment to diversity, equity, and inclusion. So how do we value, respect, and embrace families' diversity? How do we advance those concepts of equity and inclusion? And how is it reflected in our service delivery model? I know we talk a lot about DEI and inclusivity, but is it reflected in the policies and the practices for which we provide services? The second to last is community strengthening. And so this is where it kind of starts to, the family resource centers really starts to take a step further, which is what attracted the CSC to this model, is that it's not just about strengthening the family, but by being an active and engaged in the community to develop a strong and healthy community. So this is where we're going to start talking a lot about the power of collaboration. Again, we don't have a shortage of services. We have a shortage of accessing those services. So how can these resource hubs really bring all the partners together to create an integrated system of care that's much easier to navigate for our families? And finally, this concept of evaluation. So how do we look at areas of program strength as well as other areas for further development so that we can adopt a continuous quality improvement mantra in our service delivery? So it's not saying that you don't do things well, but how can we continuously do self-assessments and third-party assessments or collaborative assessments to ensure that we're achieving positive results for families? So what we did, and like the lessons again from the 3 nationally recognized family resource centers that we hosted this past Friday, is had kind of a long conversation about a variety of things. And the 4 things that really popped up were that physical locations can vary, so long as you know who you're trying to reach and that location works for them. So the family resource centers over in Alachua County had some based in libraries and a couple of other places. They had some in community centers. They had them in just in kind of a variety of different places. In Alachua County, in like the Gainesville area only, they had, I think it was 3 different family resource centers that they had kind of set up around the community. Some of them was like a freestanding building. Some was just a room within a library. And so it definitely varies. What was really beautiful about their model is that they were able to leverage public space and not pay rent. So again, speaking to that the power of collaboration and community strengthening is that they were able to leverage each other's resources. The example from Connecticut was actually a school-based example, which in conversations with the group from Connecticut almost reminded us a little bit of like the community partnership model, a community partnership school model, in that they had a resource room that was constantly staffed, that was dedicated to providing resources to families as they came in, as well as being adjacent to a traditional child care center that was open year round so that they could have access to that child care. Now, we didn't quite dive in to find out if it offered non-traditional childcare at that particular location, but we certainly know that came up in our needs assessment as something that is a huge need, is this concept of non-traditional childcare or weekend and evening care. The second kind of lesson learned was that services can and should vary, and that they should rely on community collaboration. Whatever you do, do not recreate the wheel. I think I've heard Ms. Green share this multiple times at various community events, is that we start working, that our smaller nonprofits and our smaller organizations might start working with a very specific population, and then they realize they need more services. So then they start providing those services as opposed to connecting them to existing services. So that was one thing that was a very kind of aha moment of how do you ensure that whoever's running the Family Resource Center is not recreating the wheel, but instead is engaging the community partners so that's truly a collaborative approach. So definitely something that we want to strengthen as we pursue establishing Family Resource Centers moving forward. The third lesson, which was almost a drop the mic moment, not gonna lie, was this concept of customer service is vital. That when you place families at the center of your service delivery model and you seek to engage them in a relationship and not a transaction, that's how you build trust. And that this concept of trust in all three of their examples was paramount to their success. And that in essence, that trust is really what drives service delivery. But yet, as they grew and these Family Resource Centers started to become more well-known and being more successful, more and more partners wanted to get involved. And in the getting involved, I think the lesson was learn to say no to certain partners. And it was because the partners that you bring to the table must have this same customer service mindset, that we're serving the family, that the family is driving everything that we do, because more and more people want to like have their name attached to it, or they want to co-locate services there, however that might look. But if they don't have that same customer service mindset, then it can actually disrupt that trust building process. So thinking through process-wise, that was another kind of huge lesson that we know we want to make sure that we achieve moving forward with the right partner. And the last kind of lesson learned was this idea of data collection and evaluation. So having the right tools, having the right staff in place that knows how to conduct proper assessments of families as they come in, that they know how to turn that information into a service plan, that how that drives services and how they kind of report out that data so that they continuously tell the story of their success. So those were kind of like the four main lessons that really popped up. It was a 2-hour conversation. They all talked for, each of them talked for at least 20 minutes, and then we had Q&A for about 40 minutes. So it was very, very rich. Again, it's completely open and public. You don't have to register to go watch it. It's right on our YouTube channel and linked on our website. But we just wanted to provide that brief overview of what we were able to accomplish, or what we learned from that show and tell with all of them. So we want to spend the next hour with you guys kind of talking about some of these concepts, and then any other things that might have popped up. Where we really are looking for feedback from the community is around location, the services that should be like required or offered at a Family Resource Center, this concept of family-centered services, what might be some requirements that we would include to ensure that that is baked into the model as we learn. And then we'll close out on just kind of an overview of what the funding process looks like, and kind of get your feedback on some of those questions as well. So this is where I want to invite you to come off mute or turn your camera on, and we're going to start with this concept of locations. So I'll give you just a moment to kind of do that. So what you see on your screen right now is Leon County under 18 levels of poverty. Now, the map itself, full disclosure, is a little bit dated, but the numbers that you see where it says 19.2 and the goal of less than 10%, that comes directly from the Florida Chamber scorecard for Leon County. So that's the latest data, but if you try to add all the percentages up, it's not going to equal perfect. So I just full disclosure in terms of that. They haven't done the pretty little map with the colors, but to be honest, it hasn't changed much. The truth is that here in Leon County, for as long as I can remember, it's hovered around 20%, and we haven't been able to move the needle despite millions of dollars being invested in this space. And we think that it has a lot to do with these barriers that exist to accessing services. But you can see, probably is no surprise, that 32304 has the greatest concentration of child poverty, and that 32305 and 32310 are the next areas. So when we talk about north side versus south side, it's very real and apparent here in this community. And then you'll even see within 32301 and 32303 kind of being right up there. So this aligns with all of our procurements that we've done for services, identifying these 5 zip codes. So we just want to pause for a moment and get your feedback, because this is a very large area of our community, and some suggestions. Mr. Trombetta, I see your hand raised.
Thank you. If I hope you'll forgive me for not being on screen.
Is that okay?
Not going on.
Sure, you go right ahead, John.
There's a couple of questions that come a mind to this, and it seems basic, and forgive me, but we talk about we're looking at poverty numbers, and we're looking at a concept of a family resource center. Specific goals for a family resource center, are they to increase and I understand that increasing literacy helps reduce poverty, and some of these resources sort of they're all kind of baked into it, but is there a stated goal that for the family resource centers that the CSC has set, or a stated mission anyway?
So yes, in terms of better connection, one of the goals is we want to increase the resiliency of families, and it be an added service to the prevention continuum. So what do we mean by the prevention continuum? Less referrals to DCF, less families with the verified or substantiated maltreatment. Those are some of the large kind of goal-based driven outcomes at the macro level that we would be looking at. Literacy certainly is a part of that. I think increased resiliency, looking specifically at, can we connect families to those concrete supports? So ultimately driving that there's less families living in poverty. That's the long-term macro vision. We did in the original procurement have it out there with kind of those short-term goals in terms of using the results-based accountability metrics of what can we impact at the family level. So that's where you hear us talk a lot about self-sufficiency and resiliency. But some of those bigger ones is a reduction in child maltreatment.
Okay, and just while I have the mic, I hope this isn't too much of a non sequitur. I got about a third or maybe a halfway through the presentation from Friday. Were school systems and housing support systems involved with those other agencies that were presenting?
The one from Alachua County is very connected. They're actually the managing entity, or the CDC support funded agency. So everything that comes with that, they have access to. They are working on establishing a strong partnership with their school districts. They have a pretty good one with Alachua, but for some of the more rural, because Partnership for Strong Families, I think covers, I'm going to get it wrong in terms of the number of counties, but I want to say it's like 8 counties. So I think an RCBC might actually cover even more. The one in Connecticut is very embedded in their school system, like very, very, very embedded in their school system. And then the one in Georgia has a very strong partnership with their housing authority. Their model is kind of an all-encompassing model, because while they don't limit who their patrons can be to those that are Spanish speaking, they are specifically targeting Spanish speakers to respond to the growing number. I think she said something along the lines of 30% of the population in the greater Atlanta area now are sole Spanish speakers, meaning that they are having a very hard time navigating the system in English. So every service provider is starting to refer directly to them so that they can provide that comprehensive case management services. I hope that answers your question.
Yes, you did. Thank you.
And Sika, if you want to add anything to either of those that I might have forgotten, then feel free to jump in.
So the only thing I will add to everything Holly has said is that I think the difference between, not I think, the difference between just a center that is in a community and a family resource center is that the family resource center takes the families in that community at the center of what it does. So no two resource centers are going to look the same because they're going to be governed by the needs of that community, to the point where the expectation is that there is an advisory board that is made up of those community members that help to not only do the outreach about what's available at the FRC, but also help inform what's available at the FRC. Ultimately, the FRC becomes an overused term, one-stop shop, where families can come to access whatever services they need, understanding that they may come in for one thing, but because of the triage method and the sitting the family down and going through everything that's going on with them, they are able to access the other things so that they're just not getting one support, because we know that support becomes more successful when it's paired with the other supports that they need. And then the last thing is, it's also designed to truly connect families together. And that just goes back to, it takes a village to raise a child. We don't have the neighborhood functionality that we had back in the 60s, 70s, and 80s. Maybe around the 90s is when it really started changing. So we want to become that hub that connects those neighborhood families together, such that they are now depending on each other for the types of supports and groups and the success that they realize as a neighborhood, not just as a family. So I hope that that makes sense and maybe brings it all together, the difference between, say, a family resource center and just a community center.
One thing I'll add, a while ago in our community, we had something similar that was set up, but the funding didn't last, specifically for our homeless citizens, or those that were between housing, in that they were able to co-locate service providers in a single space, so that if the big if, those homeless veterans could get there, or the individuals experiencing homelessness could get there, they could then access all these different services in one location. Now, when you add homelessness into the mix, there's a whole other host of factors that comes into it. So that kind of model wasn't working, again, because of how do you overcome transportation barriers. With them, there's a lot more barriers for overcoming. And of course, there's a huge focus on primarily just the housing and stability piece. So we were on the right track here in our community of understanding this idea of creating a one-stop shop so that a family could easily navigate the system. One of the things that we've heard in our needs assessment and in our family listening sessions is that if you are a parent and you are trying to access legal services or therapy services, or you just moved and you just got notified that you're going to get your transportation for your school is going to end, or you have to move schools now, and you don't know who to call, sure, you can pick up the phone and call 211 and get some of those referrals to different agencies. But this idea of having someone help you kind of navigate that system doesn't truly exist in our community. And we were really surprised during the needs assessment process how many families in our in all the little focus groups that we held didn't even know that 211 was something that they could call for any services and not just mental health needs. There was little to no knowledge of even the Help Me Grow program, which is specific to young children, and how do you access screening services. A lot of that, they just had no idea. And we held these listening sessions in 6 or 7 different locations all around the community, from Lake Jackson to Woodville and everywhere in between. And the story was the same. We just don't know. We just don't know how do we do it, as opposed to, oh yeah, you need to call this person or this person. This idea of that kind of warm handoff or someone to help them navigate through. And those who did know were frustrated because they would have to repeat their story. They would have to fill out the same paperwork over and over and over and over and over again. How can we solve this problem? And that's where collaboration through a neighborhood-based resource hub that's driven by the family is the model that we know is having lots of success around the country, and wanting to bring that here in response. So going back to the question about locations and thinking through that, is there anything, like looking at this map overlay, the understanding why we're talking about place-based? And I know that when we just use zip codes, it's not telling the whole story, right? But we also know that the communities in each of these zip codes know best for what might work in their community. So any kind of feedback you have on using this to help guide location-based decisions that you'd like to weigh in on or offer some feedback on. Mr. Renzi?
So one of the things that I'm noticing, the areas where you really want the services are very large, and mostly there's not a central location. So locations are going to be difficult, especially because public transportation in those particular zip codes is also not great. So I'm trying to imagine a center that can, even just in 32310, cover that entire zip code. It's almost not possible that you could have one center that all those people would be able to access if in fact the barrier is access to care. I don't know that one center or one even in a zip code in those large zip code areas will fix that problem.
You're absolutely right, Rob. And that is one of the things that Alachua shared, that why they have 3 now with plans that they're talking about opening 2 more. So we have to start somewhere. They even said they have, I'm going to call it the CUB, Columbia, Union, Dixie. I think those are the 3 kind of northern counties to that area. They only have currently 1 center with those 3. And one of the things that I know that they were talking about is the public transportation issue. Well, if they only have this 1 hub and they're trying to create this idea of a one-stop shop, families aren't going to be able, like families from all 3 counties aren't going to be able to get there when public transportation is an issue. So they're having to get creative with how they explore the transportation conundrum. So you're right. Looking at 32310, we know Fort Braden, right, is somewhere like way over here. Maybe it's even further south, right? Because with that road that kind of comes in, whereas like Pineview Elementary is somewhere like right around like in here, which is, and I think Sable Palm, right, is like somewhere like right around here, if I remember correctly. And easily we could probably, well, they have a community partnership school, so it's on the way to kind of like that resource hub, a very similar model is what we're finding. They have that, but the folks in Fort Braden aren't going to be able to access that, especially since it's school-based, that they're looking in that neighborhood. So point very well taken, that maybe we're thinking about this in census tracts. Maybe we need to be thinking about this in census tracts or like the elementary school district zones, that we're really considering that transportation piece of it. It's very, you're right, it's very vast. And if we're also, I know that our goal within this first procurement is to have at least 2 operational by 2025, like fully operational by 2025. We can't have those just concentrated, right here in the city center. We need to have some diversity in terms of just geographic distance.
And
John,
just to-
go ahead.
yeah, and just to add, of course, Rob, absolutely point well taken. But Rome was not built in a day. And so we have to start somewhere. And I think if the idea takes off and we're getting the outcomes that we expect, by the time we move into fully operational centers in a larger zip code like 32310, we could very easily have 4, very easily. And then maybe even move to 5. The idea is that the hub is truly in the neighborhood, and that allows for more centers that are really wholly focused on the neighborhoods that surround that particular center. But as with everything with CSC, we have to remind our public that we have to start somewhere. So we thought that it would be prudent and judicious to start with the establishment of 2 by 2025. It gives us the chance to really look at the data, really do the evaluation, really work hand in glove with the selected provider using the knowledge that they gain, as well as what we have already, to look at where those centers are established and when we're ready to move to the establishment of the next one. So I'll use the library as a perfect example. Happened to be talking about the public library with some team members here. And I remember when it was one library located in Northwood Mall, which is now gone, but it was downstairs at the Northwood Mall. And it was determined it needed to move more central. So we built the main library. Then it was determined that people on the south side of town can't readily get to the main library. So you develop all of these branch libraries, and now you've got branches in almost every area of the county, but it wasn't done overnight. It was done in a methodical fashion. And so that's kind of how we're looking at developing these FRCs. But your point is absolutely well taken and literally right on the money.
John, I see that your hand is raised.
Yes, thanks. I was going to echo Rob's comments because it seems, the transportation keeps coming up, and it's the same with providers around, food banks or food delivery and things like that. We were talking about the summer feeding and summer learning, really, the transportation and trying to reach those neighborhoods. And so, I keep thinking, and it sounds to me like the model is that, we're trying to get folks the resources that they need, not necessarily providing those resources, but connecting them with resources. So I'm thinking, a case manager that goes to, XYZ elementary school twice a week, and it's not so much. So you talk about place-based, and I'm thinking that's, I'm not sure if that's the model, in that you have a hub and spoke where you might have a central location but you've got, 10, 12 case managers working out of there that are going to these neighborhoods and to these, centers a couple times a week to provide, to have those sessions and to connect those services, to overcome that transportation barrier. But I also think, going back to my earlier question, that it's going to take that collaborative where it becomes one-stop shopping, where it's the CSC and maybe the Second Harvest, and it's the school system, and it's Appalachia maybe, or just all of those service providers are kind of in a group of these locations, 5 or 6 of them locations. I know Sika just mentioned 4, but just kind of going that way with it.
So
I'll share that.
Well, no, I think your point is well taken. And the other side of that is, as the school system is getting more social workers into their system, they now have a place where they can connect families. So I think it's a two-way thing that happens. Again, though, I got to emphasize, we have to build up that model. And so we start with an FRC with those basic things that we've heard from the public that are absolutely needed, and then we grow from there. The next thing I want to say is that, so CSC is involved with the United Way, the city and the county, on a Trusted Voices group. And that group, I'm telling you, transportation was the very first thing that they brought up. And so we know transportation in Leon County is an issue. And so already looking at ways to help combat that. But as you get these FRCs in the neighborhoods, you have churches in the neighborhoods, you have civic organizations in the neighborhoods. So now maybe they partner with the churches in the neighborhoods that have the vans that go on a rotating cycle of helping with that kind of transportation. So to your point, John, it is exactly that. It is collaboration at the highest possible level, putting the customer service first, putting first the needs of that specific community, and how do we break the barriers to get them what they need.
Tika, I'll just add from some of the examples that we learned from that. When you said hub and spoke, it reminded me that many of them were deploying home visitation as a service delivery for the basic core needs, but that they would also have built into their budgets transportation opportunities to bring the families in, because there's only so much that can occur to build the protective factors in families when you're in the home or when you're doing one-on-one. I advanced the slide to kind of get to this idea of the suggested services, because this is what we know. These are the types of services that we know build protective factors in families. And if you only go to the home and do that one-on-one, you miss out on these peer-to-peer supports or kind of the classes and that kind of socialization piece that Sika was just mentioning. So I don't want to limit the conversation to kind of transition to thinking about what those services, the core services would be, but we know that there are a lot of workforce development sources out there, what we would call ancillary services that are being provided that are absolutely great and wonderful. And we're not saying that those are important, but these were the ones that are on your screen now that are directly tied to building protective factors in families, and would like to entertain some kind of feedback on these concepts as well. But again, don't want to limit conversation about location. And I do see that Rob has his hand up.
So I did watch the thing this morning, from the three presenters, and I'm just trying to figure out the best way, because I know the last ITN you really wanted a provider, but when I listened to the three presentations and from the groups across the place, and I look at your map, I'm struggling with a trusted presenter in Frenchtown. It may or may not be the same trusted voice, because I know that was very big in Fort Braden. So the push-pull between, you only want to do one provider, but those are very different communities. And how one person is trusted everywhere is a difficulty. And then the other part to move on a little bit is that the ITN, I've heard several times now, family resiliency, but not real specific goals and measurements of what that would be for a respondent to say, this is what it would look like. Specific, measurable in year 1, year 2, year 3.
So I'm going to let Holly address the ITN piece because she's our procurement manager. But I do want to address your first observation, Rob, which I think is again, right on the money. So the idea is that we secure one provider, one overarching provider. So when you look at, I'm sorry, my office light keeps going off. So when you look at, I'll go back to the Alachua County model. So the funder is the CBC or the ME, and they contract with a group that manages the FRCs. And with that, our expectation is that when a provider is selected in this revised ITN and in their response, part of that is them understanding that the part of 32310 that's closest to center city, to the center of the city, as it were, Leon County, that's going to be a totally different neighborhood from Fort Brady. And so that's why part of the success of the FRCs is ensuring that you pull people from those neighborhoods to be a part of the management, the oversight, and service delivery in that FRC. And so that helps to address what you are referring to, what you're talking about. To go back to the original slide, or one of the slides, we heard repeatedly in the presentations that the customer service and the trust in order to get that customer service is paramount, and that it is important that everyone that comes into that center to work at that center, to volunteer at that center, must understand the neighborhood in which that center lives and thrives, and must be willing to meet the people who come to that center where they are before they try to bring them up, with no judgment, with all of the things that we know create barriers, even that unseen barrier between someone who's trying to help and the person or the family that needs the help. So yes, each center should be comprised of mostly people from that neighborhood. And at the very least, so I'm saying at the very least, when you're looking at the managers and the people that we say, quote, need a degree or need some higher form of education, they know that neighborhood. They are trusted in that neighborhood. They go in that neighborhood. And when they are a part of that FRC and neighborhood people come in, they're like, oh, hey, so-and-so, I didn't know. So they already kind of have that rapport. So whoever the provider is must understand that, must demonstrate that they understand that. And then when we're looking at an evaluation piece, even early on, we see that their employee role is representative of that. If you also remember, and then I'm gonna turn it over to Holly, if you also remember in the Alachua County models, they don't have these huge staffs at these FRCs. It's not some huge organizational chart, but rather it is tailored to be very intimate in the relationship of the people who work at the FRC and the community members that come in. So that would be our desire. Again, a point well taken. And that's something that we feel we can address very clearly with whomever the overarching provider is.
So I'll echo that by saying in each of those three examples, there was a single entity. For Atlanta, it was first Sur Familia, and they have 5 centers that they manage and operate at the neighborhood level, comprised of the individuals from those neighborhoods, and then they're opening one in Puerto Rico. But for Connecticut, it is actually a state entity that then subcontracts out at the local level. Again, they're using the school-based model. And then in Alachua County, the overarching partner is Partnership for Strong Families. And as Sika just really highlighted, how they kind of do theirs is much smaller. I will say that when we were first looking at this, like we were looking at a lot from California and Colorado, because they have a lot of data coming out of those states related to FRCs. We tried to, for our show and tell, bring those that are newer and or smaller into the mix to kind of, and that really reflected some of the things that we have heard in our community, like a focus on early childhood and a concern for our growing Spanish-speaking population. That's why we chose those to come to the show and tell. But originally in doing kind of looking into it, You may have heard Alachua share that their centers operate around 180,000 per center, whereas we budgeted around the 450,000 per center because of staffing. At max capacity, what we're seeing out in California and Colorado are much larger centers because of the population, the numbers of families that are coming through. And Alachua actually said, like, this is what we have funding for. We would love to have more staff at each of those, but they are figuring out how to be lean and mean and rely on those collaborative partners. So I just wanted to kind of echo that piece and thinking through that kind of trusted voices. The other thing I want to add to that is actually a part of our conversation around this idea of parent advisory councils. We're not looking for a parent advisory council for all FRCs, but for each FRC. And that's something that makes it also very unique and different from just resource centers. Each FRC has some sort of advisory board and an investment in parent and family leadership at that FRC. So that helps to create that trust. They're the ones that are helping provide feedback on the types of services that are being provided in that neighborhood. In fact, one of our presenters shared, yeah, we ended up finding this provider to do Brazilian martial arts for the kids over the summer because that's what the families said that they wanted. So they're building those out so that they can be very reflective and responsive directly to the neighborhood that they are seeking to serve, as opposed to having an overarching parent advisory council for all FRCs that we're trying to build, or having, you know, God forbid, the token parent leader that just sits on the quote board, right? It's really flipping that. And the national providers at Casey Family Programs and Friends National Resource Center have bunches of tools and trainings available to anyone who's venturing down this path about what does authentic family and parent engagement look like. They have trainings, they have self-assessment tools. So we're thinking about, is that part of the requirement of the service delivery, so that they develop that, which gets me to your question, Rob, which is about what are those outcomes. So in an invitation to negotiate, we know that we have some general kind of big community-wide results that we would like to see eventually. But depending upon the service model and depending upon what the issues are in those particular communities, we have flexibility to develop that, which is why we chose the procurement instrument of an invitation to negotiate, as opposed to a request for applications or even a request for proposals. The idea is that we have a general direction we want to go, but we want to find the right partner and go there together. The beauty of our procurement law in the state of Florida, which is totally accessible to us as a special district, is that we can use the right instruments that are available to reflect what creates the best value for our community. And if we're too stringent or rigid in the application instrument of how are you going to accomplish A, B, and C, we may miss out on something that a particular partner could do really, really well, or that a great partner gets overlooked because they can't do certain things. So in the process, which I'll actually kind of just show that to you right here, and we can kind of jump around since this is an open conversation, is this idea of resubmitting their best and final offer after we have conversations. So we write a general application, they respond to it, we score that, and then some of those top candidates that there's merit to, we want to meet with them and have kind of a negotiation or an interview, if you will. But what happens during that interview process is the creation of, you did this really well, but we really want this, and you didn't really address it. Can you come up with, can we find a middle ground and kind of go this other direction? So you won't see the super stringent, we want to see our, an 18% reduction in child maltreatment by year 3 written into the procurement document. That may very well be written into the contract or in the renewal for services as we get there. But it's purposely left open to interpretation so that we can understand the capacity of the applicants before fully getting there. So I do hear you that resiliency sounds a little bit vague. there are verified instruments and validated tools that are out there that reflect how do you build that, but it's directly with the families that are being served. So I do want to take a moment and actually go back up to the suggested services and ask the question, this list, again, was developed keeping protective factors in mind. How do you build protective factors in families? And that these would be the core services that must be provided. So we're curious, from your perspective, is something missing from this list? Is something for the core services? Again, ancillary services are things that are very important and that we want to provide, but this is what tracks the protective factors, because we know if you build protective factors, you reduce the risk of child maltreatment and family insufficiency. So that's what we're trying to do, is prevent child maltreatment, increase family resiliency, strengthen families, and thereby strengthen communities. Do we feel this is pretty comprehensive? So this is where, Sika, I agree with you. If we were in person, right, you could see everyone's faces and kind of the nods and stuff. But all I got is Corey.
It looks pretty comprehensive. I feel like there is I don't know what it is. I feel like there's a piece missing around youth programming or youth, I see the mentoring in there and stuff like that, but in terms of like connecting, youth with a Boys and Girls Club program that might help them, or a youth sports program that might help them, or a tutoring program that might help them. And maybe it's in there somewhere and I'm not, looking at the right wording, but I guess I feel like that's that school age piece is where I'm struggling.
So maybe right now it says child development activities, but maybe if it was child and youth development activities and the examples were less early childhood focused and more comprehensive.
Yes.
Okay.
That's exactly
that's great feedback. I thought I was going to live edit for you on the screen, but it's not for some reason. So,
yeah, and so
but we are taking notes.
So Holly, I think what we want to do is create, I want to keep the child development activities in that focus. I think that that's good. I think we want to add another bullet that says youth development activities.
Okay.
The only thing I saw that is a good list, and listening to them as well, it's any things around homework skills. A lot of, once you're in school, if you're doing well, you're more likely to stay. Some of the parents may not be able to provide the assistance for, I don't know how you want to say that, educational assistance or.
Great feedback. I think within, I'm paring it back and almost combining your and John's suggestions of youth development activities, which is mentoring, tutoring, after school, or just enrichment opportunities, and maybe even taking it that kind of step further of I'm going to say youth workforce development.
Mm-hmm.
Does that capture? I want to make sure that I'm not adding something that you're not saying.
Tutoring would be excellent, I think, anywhere in there that you, school age.
Okay.
And one other thing I wanted to bring up, and Rob can probably comment on this too, is healthy living or healthy healthy eating, healthy anything, just sort of a health awareness, health outcomes acknowledgement in there somewhere.
Yeah, I think for me, we can elaborate that under life skills advocacy.
Yep.
Okay. I will say that one of our things from our needs assessment that we did discover is that there is a plethora of health services. Again, it's about access. So when we think of the core services, I just want to remind that just because these are the core services still does not mean that the applicant is the provider of these core services. We just want to stress that even with, and it just reminded me with health services, and really should with maybe even after school or tutoring. Like, we have so many amazing tutoring programs and apprenticeship programs, but families just don't know how to access them, or maybe they can't afford them. So I just want to reiterate this message of, while these are the core services, the applicant that is the manager, management company, doesn't have to provide all of these themselves, right? So where are those opportunities to bring in the existing service providers, maybe even particularly in a neighborhood that they are suggesting to service? So I know we were talking Fort Braden earlier. We know that a Boys and Girls Club has just opened in Fort Braden. Would they be the right partner for an application to support in Fort Braden? Maybe, maybe not. We're certainly not advocating for anybody. Maybe there's another program that's out there. And the same thing with this, when you said healthcare, reminded me of that.
Yeah, and I guess that brings a question to mind, is that are these going to be is this going to basically inform the matrix that managing entity is going to be graded on? And if so, I guess then I may want to push for a youth health development or outcomes tenet to that matrix. But if this is just more of a guide, then, to your point about it, they're not going to provide these services, they're just going to connect these services. Then we could, leave it in a life skills type place.
And John, again, just to re-emphasize, we're talking about a starting point.
Right.
As the FRC develops, that neighborhood, that community, in addition to data and all the things that we know, help to expand those service provisions and look at those collaborations that come in. So what I would imagine is that there would be a base level of service when you're looking at evaluating outcomes. And then you also have kind of that special area, because there are going to be some services that are in one area that may not be paramount in another area. So it would be wonderful to open these centers and everything is like there. But I think some of it is going to be demand-based. And again, it's a building block. It's a building block. So, because I hear what you're saying, I'm like, ooh. And then I'm like, okay, so you could slow down.
We got to walk before we run.
Walk before we run. I got you. But I love everything that I'm hearing. Yeah.
I think when I think of protective factors, those concrete supports in times of needs, or in knowledge of parenting and child and youth development, I immediately think that what is the role of our county health units, and what is the role of our partners like Bond Community Health or Neighborhood Medical and some of those clinics that we have around? What is their role in relationship to these? But that's kind of that is kind of going beyond that, what we know in terms of the core services. Just like transportation, we know that the Family Resource Center can help address some of those transportation barriers, but it's not going to solve transportation. It's not, we might be able to work with Second Harvest or Farm Share to do some of this work, but it's not going to, in terms of to help address neighborhood food instability, but it's not going to solve it by itself. That's why collaboration is so powerful. So I think healthcare is one of those as well. Nancy, I see that you've raised your hand. Feel free to come off mute and share.
Okay, I'm going to try to figure out how to phrase this. And maybe it's not appropriate for this meeting, but I have not heard anything that addresses the issue of the fact that all of these 1,000 small providers and big providers and service providers and so on are still fairly firmly siloed. We're better about networking, but still not great. Is there something built into this invitation to negotiate that will address the issue of, okay, if we enter into an agreement with you, how is it that you are going to reach out to, access, request proposals, sub-proposals, or services? How is that piece going to work efficiently?
I think that's a,
And let me just say, I'll use what we are trying to do as an example. NAMI Tallahassee has an education program for parents of and primary caregivers of children who live with mental health challenges. And it's called NAMI Basics. And we have written a rather large grant, which we're hoping to get, where we can focus on one Title I school. We have the principal on board, where because our schools already have a very efficient transportation system that we're really making a mistake if we don't use it. So we're going to keep the kids after school. The parents are going to come. They're going to have an incentive to attend the class. It's going to be worth their while. And we're going to have a lot of research based on it. Does the child's attendance improve, behavior improve, grades improved? This is, and then the ultimate goal would be to have this be so successful that we could start expanding to other Title I schools. And because we get a lot of feedback from principals that a lot of our kids are being Baker acted, and something really just has to happen with the mental health issues. So if there's a family resource center, how do I market's the bad word because we don't charge, but how do I get the word out through the Family Resource Center that this program is available at your child's school? Is that another tool for me to use? Is that appropriate? Who's going to decide what's important? Who's going to decide which service to use? I haven't heard any discussion about the next step. And I know Sika keeps saying we got to start at the beginning, and I get that. But you got to have the services, and how is that anticipated to work? I hope I've been clear. I'm sorry.
It's an excellent question, and I want to make sure that I didn't mean to cut you off or start to like get excited about it. Breaking down silos is something that we always intended for this to do, but in the original publication, it wasn't strongly written in terms of how does an applicant demonstrate that. It also wasn't highly scored in the original matrix. So that was some of the feedback that we received during the process from the council, and something in terms of observation that we were able to see. So you bringing it up 100% is something like that feedback is really valuable. You'll see here on the screen that third bullet, resource and referral. The idea is that that would be a core service that the provider, that the Family Resource Center offers, but it's more than just that warm handoff. So everything you said about how do they decide which partners to work with, what types of resources are they referring to, largely would be governed or kind of dictated by what the needs are in the community and what that parent advisory council say they need. What we learned with the family listening sessions that we did earlier is that there is such a need to address the basic needs of families, that the things that we know, like early reading and early literacy, mental health, like these are things that when you have food in your pantry, a roof over your head, and shoes on your feet, that then they can start really thinking about. But we as in the provider community know that we have to be working on all of these things in tandem, right? But when we have our family listening sessions and they're telling us what they're like, they were talking about housing, legal services, respite care. Like these were the things that were popping up. Attendance at school and like their kids' school grades, like wasn't even a concept. Like I think it may have been mentioned twice across the 4 sessions that we had. So mental health definitely came up, but not as often as you would think. Yet in some of our listening sessions with young people, they brought that up a lot. So how we develop the centers is, what is the plan? So what we're going to be looking for in the ITN specifically is, what is your plan to determine what types of resources that you need to have available, and how, like what is their plan for engaging the right partners. Again, we don't want an application or an applicant to say, we're going to do all these things and we're going to provide all these services, because it doesn't work that way. All of these great partners are out there, and we're trying to break down those silos. So we can do a better job at being more descriptive in the actual application of saying, how are you going to work with a plethora of community providers to address these needs as identified by our initial family support feedback in our needs assessment. But again, ultimately, it would be driven by what that parent advisory council says.
Mhm.
It's a really great question. Other reflections on suggested services. I've documented here, and we'll add to this in tomorrow's feedback session as well, but I've documented so far adding in a separate bullet related specifically to youth development activities, to include things like mentoring and tutoring and other enrichment activities and referrals, to explore this idea of healthy outcomes for children, maybe nutritional advice, either in life skills advocacy or in with youth development advocacies, and ensuring that collaboration actually happens for that resource and referral piece, whether the resources are in-house or families get referred, that we really strengthen that in the procurement itself. Now I recognize it's 1 o'clock. And we only got through 2 of our kind of concepts, but we did kind of touch on some of these. And so I want to encourage all of you to come back tomorrow, but I do just want to provide a kind of just an overview in terms of the funding process. Yes, we are seeking that single provider, but it is really a collaborative that we're hoping to award, not reward. And it's a 4-step selection process. So I think I hit on this briefly in terms of evaluation, negotiations, best and final offer, and then that final review and recommendation presented to the decision-making body. I bring this up because we will present this to the council this Thursday at our meeting that will be held at our office on July 20th at 4 p.m. You can kind of join it via YouTube or you can come in person. And some of that they're going to weigh in on in terms of what this process looks like. They may choose that all 8 members of the council, maybe they separate in half and it's 4 and 4 doing some of half of it and 4 doing the other half. It may be that all 8 do all 4 steps. They're going to kind of weigh in on that. So if you feel strongly about this part, we invite you to come to the meeting on July 20th. If you can't be there in person but would like to submit something being read into the record, those can be submitted via email. As long as we receive them by Wednesday at 12 o'clock, then we can include those in the written record for that meeting on Thursday if you can't join us in person. So with that, anyone who needs to leave because it's 1 o'clock, we want to invite you, or we want to say thank you for being here. But if those of you who would like to stay on and kind of talk a little bit more about this idea of family-centered services or have any feedback related to how do we ensure that, then please stick around. There's no judgment for anyone who drops off. That's perfectly fine.
We get it.
But we definitely just maybe take a couple of minutes to kind of just, if you have any feedback related to family-centered services, again, for those that have left or thinking about leaving, it's being recorded, it's on YouTube, so you won't miss anything. But this is your opportunity to weigh in and provide some feedback. In the original ITN, we described this idea of member services versus drop-in services. And so we explored that a little bit with our lunch, with our show and tell that we had with the FRCs last Friday. I particularly found myself leaning, I love this idea of for patrons and partners as opposed to members and providers. But this concept of you have your drop-ins that just kind of come through the doors and might access some services, and they're kind of like those like one touch and dones, or maybe they're just coming in for like for one meeting or a group meeting, but they haven't necessarily taken on and I'm going to use in quotes, a case manager. And that would be what a member, like if they come in and they're like, I need help, and they actually go through an assessment, and that assessment that is conducted, that's where we're going to start following them and making sure they have access to services. We want to ensure that anyone who comes to the door can be helped. So this actually was brought up, even if you're a center that is designed to service Spanish-speaking families, yet you come in, you don't speak Spanish, that doesn't mean you can't get services. So that would be the difference of like a member versus a drop-in. Or perhaps you come in and you just come to like a mommy and me play group that might be offered. Or maybe you come to a job skills training, like a one time, that would be a drop-in. A member is someone who would actually kind of come in on a very regular basis. Maybe they sign their child up to attend some sort of summer camp that's being held there, or if the FRC offers non-traditional childcare, right, that they're kind of like enrolled into a program that might be offered through the Family Resource Center. That's the difference between those. And so we know that they're in the question period. For the last ITN, that came up as like just describe these differences. So we just wanted to ask the question of, is using member and drop-in, does that make sense? Is there better language that we can use to help differentiate between these two types of patrons to a Family Resource Center?
I'll say while I like the term member, I always hesitate because it feels like it has an exclusivity about it. You know, that well, I'm not a member, but, or how do I become a member, or that sounds like something I have to pay for kind of thing.
That was definitely the concern that erupted previously. We'll think about that. That could change, or maybe the better response, Sika, is we're using them in quotes, but your proposal, if you have a better terminology, put them in a proposal, right? Like for anyone who's considering applying for this, or maybe you're a collaborator for someone who's applying for this, thinking through that. If you have something better, know that we're calling it that. That's what we mean by it, but that might not be the right language for a lot of the reasons that John pointed out. We talked a lot about parent advisory councils and parent family leadership self-assessments. Again, I just want to reiterate that it's for each family resource center that is being proposed, not for one overarching like parent leadership board for the entire group. So that's something just to kind of keep in mind. And I think that concludes my questions. Sika, I want to kind of turn it back over to you if you have additional questions or comments that we didn't cover that you feel we need to.
No, I don't think so. So we'll have another one of these, and you can feel free to join in on that one, because you could leave this session and think about something you want to be sure that we know. You can also email us. Please feel free to do that. You know, but we really want this next procurement to be crystal clear about what we are trying to develop in our community. And more importantly, we're trying to speak to what our community said they wanted, said they needed. And then once we get that provider, have them be a part of the development of these in the neighborhood. So thank you so much for participating. Just don't be quiet, because once we issue the new ITN, we can't talk any further, or give you any ideas, or answer your questions outside of the procurement process. So now is really the time to provide those comments, any ideas, any clarifications, anything. So we just thank you for joining us, and please feel free to spread the word that we'll be doing this again tomorrow night.
Sheikha, I have one more question. I'm sorry, it's John again. Is there going to be technical assistance for applicants?
Absolutely. There will be technical assistance. We are going to encourage all potential applicants to take advantage of that. And so, yes, absolutely.
Okay,
All right.
thanks everyone.